Good evening. My name is Harriet Martin, and my presentation concerns healthcare associated infections, quality insurance plans. Every year, 75,000 patients are hospitalized and die from HAI infections. HIA infections are infections that people receive while obtaining another type of services from healthcare. Every day, at least 1 in 25 hospitalized patients develop an HAI infection. According to the Centers for Disease Control and Prevention, they have developed a national program known as the Emerging Infection Program, or EIP. This EIP prevents and controls infectious diseases by providing high-quality scientific information in monitoring emergency problems, evaluating public health interventions, and informing policies. The CDC's EIP guidelines, the healthcare associated infection components, are associated with state health departments and academic medical center partners to monitor, ask critical questions concerning emerging HIS threats, advanced infection tracking methods, and antibiotic-resistant organisms across the United States through scientific data collection and information gathering. HIAs can occur in any hospital setting, which can be problematic for health administrators. My investigation is going to deal with HIAs occurring in a hospital's acute and chronic renal units. Over the past year, 35% of renal patients have experienced graft infections post-surgery. Another 25% has seen increases in catheter infections, as well as an overall increase in hospital admissions that cost the renal patients added cost and utilization of hospitals. For an administrator, this can be very problematic. After collecting data and graphing it, I found that in fact there was a problem with increased infection rates in both grafts and catheters, as well as increased hospitalization admissions. So I propose on creating a continuous quality improvement plan, or CQI, which creates an environment of continuous process flow by one, focusing on the process, focusing on the customer, focusing on data-based decision-making, empowering employees, and impacting the organization throughout the whole organization on quality. The first element of a CQI process is asking some very strong questions. For instance, what part of the surgical process needs to be changed or improved to prevent infections? How do we decrease hospitalization admissions due to the infections? The second element is to focus on the patient or on the customer, which is going to be the dialysis patient and their families. This can also include customers as being the surgical doctors, the renal doctors, and nurses. A third element of the CQI process is using database information to make improvement decisions. In other words, we want to collect data which will reduce uncertainty and biasness. The fourth element of the CQI is empowering the employee. If the employee sees a problem that needs to be corrected, the frontline worker, through training and empowerment, can make those changes, which is going to increase quality for the patient. And the final element is the organization-wide impact of using a strategic planning to coordinate as well as to continue improvement of various operational processes to enhance positive quality outcomes every day throughout the entire organization. To accomplish quality improvement, this is a very essential move. The method used for quality improvement movement is to identify root causes through analysis of errors, controlling and understanding the source of the variations and or defects present through a scientific process. One of the best known scientific processes is the Plan, Do, Check, Act, or PDCA. This is widely used in a lot of companies that have a quality or CQI plan. However, in healthcare, what we do is we add an additional element called focus to the PDCA. The focus incorporates find, organize, qualify, understand, and select. This has become the major healthcare model that's used nationwide. What this does is, with the addition of focus, that part of the equation provides steps needed to implement, while the PDCA represents the actual process changes. The steps of focus involve the following. Find, which means identifying a process problem to address. Organize means putting together a team of people to work together on the identified processes that need to be changed. Clarify results in the team moving from the process problem using quality improvement tools such as the flowcharts. Flowcharts or mapping provide a visual picture of the sequences of steps necessary for the process. Understanding means using measurements and data collection as key matrices to document the activities of the process problem and to provide benchmarks for setting goals. The S means identifying a set of process improvements and selecting which set needs to be implemented. The PDCA involves the Plan, Do, Check, and Act, with Plan, which takes the process improvement from the S portion of the focus. The Do is the actual implementation of the improved process. The Check is studying the improved processes using identified measures and matrices from the U phase of the focus. And Act means actually determining whether the process improvements are successful or not. When focus PDCI is paired with either lean or 6-gamma methodologies, then errors and waste can be cut down drastically. The lean methodology removes waste from processes and improves efficiency through specific processes. Six Sigma is a data-driven quality methodology that eliminates variations from the process. What is essential for the 6-gamma methodology is that it uses resources tools such as training and quality improvements of members of the team. Quality improvement concepts are used, time is used, and personnel resources to complete improvement projects. Six Sigma is best utilized when applied to essential, costly issues backed with good sources of data. Dealing with the HIAs, we do have a good backing of resource data. And so Sigma 6 would be a perfect methodology to use as my CQI plan. Six Sigma also uses what's known as a structural process called DMAIC, define, measure, analyze, improve, and control as quality tools. And these steps are very similar to PDCA. Define in the Six Sigma is determined by using due dates and mapping future process states. Measure incorporates both creation of measures and matrices along with applications on how well the process is performing. Analyze breaks down the process into smaller pieces to enhance better understanding and includes flow charts to visualize the process. Improve deals with specific steps to meet the goals during the defined step, and control ensures improvement is permanent throughout the organization rather than being temporary. Lean, on the other hand, looks at waste in the healthcare system in areas of overproduction, inventory, motion, transportation, overprocessing, defects, waiting, and underutilization of staff. The lean explanation includes overproduction, where products are in excess or are early or are faster than needed to be used. Inventory is excess of products or materials not used efficiently. Motion is referred to when patients, inventory, and personnel are moved inefficiently around a facility, department, or unit. And transportation is the movement of products and materials. Overprocessing occurs when products are given to patients which are complex and confusing. Defects include medical waste and or delays in treatment. Waiting is a feature that plagues all U.S. healthcare systems nationwide, like waiting on a doctor. And underutilization of staff occurs when staff is not used effectively. For HIA infection QCI program, the lean really doesn't manifest itself at this particular time, whereas the Six Sigma is a much better methodology. In conclusion, to make quality improvements permanent, the process of quality improvement must continually change, and that change must be managed successfully. This is known as change management, which is also an important essential part of CQI programs. An organization that can well manage the changes that are necessary will prove to be successful. And there are two components that are needed. One is the organization's readiness to change, and two is the organization's preparedness to change. If one or the other component is not present, then the quality implemented will meet with little success. Thank you, and this concludes my presentation.